Sorry, Corey? Oh, she muted. Okay. Um,
Sorry, I was just telling the Chandra I was talking to and I forgot I was unmuted.
oh, no worries. It's all done. We fixed it. Okay, so gee, yeah, I can see why you'd be worried if they're going. Yeah, yeah, yeah. I'm concerned about this issue overall. After our conversations during the week, um, I do know there's a huge issue in India and we need to support each other. And we've said this, and I kind of want to work toward creating some sort of group or something team that can support other people, to get the right information out there. Not this, we can talk about it later, but this whole thing, oh, she's -2 station. She's niggling. Oh, for no good reason, except that I'm an impatient.
On one centimeter dilated. Why do you want to do end user? Right?
Impatience. It's completely impatience. I personally am an impatient person. I really am. I get in a car and I speed. I'm impatient. And I think the world is on high speed now. And you just have to get that, oh, okay, you're 40 weeks gestation. Okay, you're 37 weeks. Let's get you going. I just can't wait to the end. Everybody has to open their Christmas presents early, and it's just messing everything up.
I agree completely. It would be great to get a group going.
Yeah, to support the proper information. And in India, it's a huge ass challenge because, there is this hierarchy, there is this social status that's super important. And doctors just say what they want to say, and you just have to take it. And even though there's such a large, there's actually a lot of knowing amongst the people, right? Everybody knows something's not right. They keep going to the hospital, but they know something's really, really wrong. And we all know that what's going on is misinformation. It really, really, really is impatience. For no good reason, just impatience. It's the modern times. We don't like waiting. And I think it's important to turn our clocks back and go back to birth, to healing, to recognizing birth is in control, nature is in control. It doesn't get recharged by a USB port. You can't fast forward it. You just have to go along for the ride, and it's better this way for everyone and the planet, is my belief. So I think we need to stand up and support each other like, a stick individually can snap. And certainly you see these individual women standing up and trying to support other women, or mothers trying to stand up for themselves, other hospital care providers knowing this is wrong and maybe trying to stand up. But one stick alone, they snap. So if you can put lots and lots of sticks together, and then, we can stand by and strengthen ourselves and support each other when we stand up against this nonsense. Anyway, that's what I would like to do, and see if we can't form something. Are you getting more messages, Shabadi? Are you getting an update? Yeah. Yeah. Tell me.
She's just going to call me in 15 minutes. They are doing an NST right now.
Oh, well, anesthesia, or just the what did you say? What did they
just checking? Just checking the baby's heartbeat.
Right. Okay. Oh, well, see what happens.
And they have all these 9 months till yesterday, her BP was all right. Today, they just when she went for the checkup, they told her she's 1 centimeter dilated and everything. But now they have told her that her BP is high. Just today, her BP is high, and all these 9 months it was okay.
Yeah. Anything.
Exactly. And like, seriously, I don't know, like what Tapasya is doing is really great. Like, we should start doing this in India, free births and home births. There are
Yeah.
people who need this.
There actually isn't an alternative, really. You can have a very, very expensive birth center, and that's great. I don't debunk this at all. That's wonderful. But it is limited for who they can care for. It's only the most wealthy and brave. And it's just not enough. It's not even a dent in the population of India. And this is a forceful nation, India. You need to. I think they just need this positive birth to help. I don't know. I just think it's really important. This is empowering. This is humanity, I believe. The start. It is the absolute beginning of humanity. So I just think we have to. India deserves this. India
Yeah.
deserves to be protected. It needs to be protected, doesn't it? This is the women of India. They need to be protected. This is our job. This is what Indian culture has taught us too.
Yes.
This is
True.
coming from you. So we have to step up and do this.
Yeah.
Yeah, it's just so important in my heart. It's so important. Tapasya, tell us.
Okay, I was so excited, and my kid got up. He gets up at 5 o'clock. Sometimes he doesn't eat his dinner. He gets up hungry. I have to give him food, and then he goes to sleep. It's crazy. But anyway, uh, I guess we were discussing the last week what happened. I was reading the messages about the childbirth educator and whole thing, and I don't know. But yeah, I have my different perspective on that, so I won't take your time on that. Maybe we'll discuss it later. But it's the same dilemma of every childbirth educator in India, that find a provider and the providers are not supportive and whatever. The gist of the story is, whenever you speak up against the system, they are going to stand and they are going to make you fall down.
Yep.
They will try everything. So most important is like strengthening your inner, like it's your path, and whatever inner work you do to build this and to walk that path courageously, that is what all matters. I mean, that's my take, and I totally agree with you. We need to build a network of support.
Yep.
Yeah, because I'll be soon working in India, and it's, I don't know, because the last two births I had, they were amazing. Yesterday was superb. I have a couple of questions for you after that, because it kind of remained in my mind. I'll start with the first birth story. It was with the midwives. It was their clients, and I met her in her like 33 week. Um, and they introduced me just as a birth photographer and apprentice. And that's what I do in the births with them. So this couple was very particular because they live in different homes. They don't stay together, but they are having a baby together. The man works in a zoo with elephants, and he's
Okay.
been to India to work with the elephants in Sri Lanka and whatnot. And he wanted to witness that birth because, according to him, that is the only animal thing remaining in humans. And he really wanted his son to come in this world the way nature has designed. And the girl is also similar kind of thing, because they call her hippie in her family, because she is hippie almost, because she's been to India. She's pretty much into spirituality and so many things. So if you have heard, in Peru they do a ceremony called ayahuasca.
Mm-mm.
They drink a concoction of a leaf, which is supposed to transport you in alternate states of consciousness.
Okay.
And it is, yeah, it's pretty famous among midwives because those are the states we touch during the birth. And in, I mean, alternate states of consciousness, because a laboring mother is never in her beta brainwave states. She's always in alpha, theta, and deep delta. So so it's pretty famous in South American midwives, that plant, because it's kind of, it's not marijuana, it has a very religious kind of status, because it's a ceremony, kind of a Japanese tea ceremony. And then a shaman will give you that drink, and you are supposed to share your experiences or internalize them, and it's amazing. So that girl had done this, I mean, this ayahuasca ceremony all as well. So it was pretty interesting for me to see how she navigates her labor. The second part of the story was, she always had her hemoglobin at the start of the pregnancy at 9, and at the end of the pregnancy at 9. So it was kind of interesting for me, because at the same time I was studying the physiological anemia of pregnancy. And because your blood volume is increasing by 50%, and your red blood cells are increasing only 30%, and plasma is the rest. So you are not going to see increased hemoglobin, or the hemoglobin that doctors want to see between the ranges of 11 and 12 in a pregnant woman at 28 weeks onwards. So and Fry says, for the best results, best outcomes of pregnancy, uh, which indicates that your blood volume has expanded 50%, the hemoglobin between 9.5 and 10 is will always give you a best outcome in terms of risk of hemorrhage and stuff, because you know that the blood volume has expanded. Mm-hmm. And that is why the hemoglobin, it's just like you add more water, the contents will be diluted.
Yeah.
So, but most of the doctors will ring the alarm bells whenever the women's hemoglobin goes between like 9.59, and they are like worried. And so the midwives I work with, they are pretty clinical, they are licensed midwives. Okay. So they were like, no, 9 is too low, you have to get 2 iron infusions, I mean IVs. So at 34, 34 weeks she got one, and at 37 week she got the second. Okay. The IV iron. I don't know how that works, but still her hemoglobin was 9. And on the other side, we were counseling her for the nutrition, the eggs, the herbal teas and herbal tinctures, and because nettles help with iron and etc. So yeah, that was one part of the story, because she used to whenever she used to talk, you could see the breath, I mean, every time it was there. Shortness and I was kind of worried, I mean, you see that in a lot of pregnant women, in at the beginning of the pregnancy, but not in the end of pregnancy that much. But yeah, some will remain always out of breath. So that was one learning point for me, that low hemoglobin is not always an alarm bell, because it might be the way they live, I mean, the way their body works. So she might be chronically anemic, but then I should not risk her out of my care only because her numbers show a different story. I should look at the whole person, and maybe she can be counseled in her nutrition and stuff. So that so that was there. And the labor started in the morning. She was having a few contractions and here and there, and it progressed. So they finally called us at 2 a.m. the next day, and she was progressing beautifully. So when we reached, she was already on the verge of transition. She was in the water, and we went there at 250, maybe 225. And then she was progressing very well. Her husband was an amazing support. I mean, I have never seen husband supporting like that so fully, because all three of us were sitting in her living room, chatting and drinking mate. Mate is an Argentine kind of tea.
Yeah, that.
And stuff.
Yeah.
Just two of them. He was massaging her back and giving her whatever. She was in the pool. The water was hot. He was kind of replacing the cold water, and he had all the setup with like pump and all. But finally, when she came to the transition and pushing stage, she came out of water because she was squatting in the water, and she found that the buoyancy was not helping. I mean, the gravity was not pulling the baby. Maybe that was her thinking, that she said, my sacrum is hurting too much, and she wanted me and the husband to press the coccyx inside. And the midwife said, maybe that can feel good, but that is not good. I mean, we can't keep doing that, because we need your pelvis to open, like the coccyx has to move back, not inside. Just because it is giving you some pain relief, we cannot keep doing that. So maybe if you want to try a different position. So she came out of the pool and got on the birth stool. She was having urge to push, so she was pushing. In a couple of pushes, the midwife again checked her. I don't know why, but she did. And she said, there is a cervical lip. I can move it with the contraction. And it was hurting her a lot. So the midwife tried it once, and then I don't know what happened. She just let go. She never touched the woman again. She said, no, you're doing fine. I don't know what happened. I mean, did she move it, or did she feel that it is going to go away on her own? I'm telling this because I want to compare this with the free birth I attended. Okay. And so the baby started moving down, and she was pushing beautifully. I mean, you can see in the video, the head comes out. I got some beautiful photos. And the father comes. Father wants to catch the baby. It's like a small corner because it's a small room. There is a big birth pool, and in one corner we have this birth stool. One midwife who is constantly wants to take heartbeats, and the other supporting her from back, and the father who wants to catch the baby. So I'm the crazy birth photographer who wants to stick in my camera. But anyway, that birth progressed beautifully, and the baby came out as if flying. But after the birth, we observed that she had small tear, like up and down both. But it was not severe. So midwife said, you just keep your legs together. We don't need to stitch you. It's not even first degree. It's just an abrasion. So, and secondly, after the birth, she had really painful contractions. And her, well, in an hour or so, her placenta should have released, but she was still having painful contractions, and she couldn't pass out. I mean, she couldn't push out the placenta. So what she did was she climbed up on her all fours in her bed, and the midwife gave the gentle tug on the placenta from the back. So my midwife tells me the direction that you always tug on the placenta from the back, never pull it forward, like not towards the face of the mom, because of the shape of the yoni and the uterus. So it will always come out down and back. So she told me, I mean, she asked me to observe carefully how she did it. She did it, and the placenta came out whole, and I just catched it in the bowl. So and that was that. I mean, the everything went well, smoothly. That which the fear was that she might bleed a lot because of low hemoglobin. She didn't. It was a normal birth, and sometimes I thought that why would she bleed more if her body knows that she has less blood? The body will keep the blood inside. I mean, I don't know, that should be the wisdom maybe, because I didn't fear that she will bleed. But the midwives from the start, they were telling her that, okay, you need to get these infusions because we are not comfortable with your numbers. And I was telling them, you are worried about hemoglobin 9, and if you see Indian population, most of it is an anemic. And I've always, like, the small bunch of women I've worked with, I've never seen a woman go beyond 10 in her last weeks of pregnancy. And then when I read the textbooks, then I realized that, yeah, this is the norm. Like, your blood volume is expanding, so the hemoglobin is supposed to go down. Yeah, so yeah, that was the birth. The second birth was a free birth. This was this lady had her first birth with my midwife, with my preceptor midwife. And she works she's an acrobat, so she, yeah, blood, yeah, we'll talk about blood clotting factors, I mean, yeah. And so before I go into the next birth, shall we?
I don't know. I was getting into the circus. What were you saying? You were just saying
She was,
something.
she's
I
an acrobat. Yeah.
I
Yes,
just
sir.
had a question about the previous birth. Like you said, there was this 1 hour difference, and okay, that mom is calling me. So this I'll come to my question because I need to attend the call.
Sure.
Yeah. Let's finish this off. The what were you saying about the blood clotting factor?
Okay, so it's not just the low hemoglobin, which is the red blood cell. In it, you're looking at, we're doing blood, you're doing a complete blood count, meaning you're looking at all the different factors, elements, and composition of what's in our blood. And so it's not just the red blood cells. Of course, this is vital. That's what's giving oxygen to everything. But in addition to that, they also look at blood clotting factors, which are different than just the hemoglobin. And this plays a role in your blood being able to clot and therefore stop bleeding. That's just part of the process and the understanding or physiology with it. Although there was a point when you said it that I wrote the words down to remind me to say something a little bit more, but I forget what it was now. But I wanted to make that point. That's part of what they're looking at. And that's what the other thing was, the ability for the blood to clot. And yes, I was always amazed in India, I saw people with him regularly with counts of 5, 6, 7, regularly. And not regularly, across the board. It didn't matter if they were foreigners. It didn't matter if they were villagers or educated. They all had low hemoglobin like this. I actually do see people in the West. I will see people with hemoglobin between 10 and 12 all the time, no problem. They might drop below 10, but we usually try to keep them up around 10. But India, I was lucky to see them at 7. I almost never got them to 10. 10 was a red letter day, but that I don't know why that is. I just decided it had to be something about in the food or in the environment or something that caused this for everyone. Almost. It became normal, right? What's normal? The majority. So this was the normal, and nobody died from this. I was always concerned about hemorrhaging, and hemorrhaging is one of the things I see the most of. But I didn't see an increased rate of hemorrhaging. I didn't see an increase of bad results or bad effects from hemorrhaging. You know, like if you see the technical definition of a postpartum hemorrhage is over 500 mil, right? Which of course, really what you need to look at is the woman. But so in theory, I'm thinking with my head that, okay, well, this woman's, I can't get her over 7 or she's stuck at 5. I can expect that 250 mil will be a hemorrhage for this person. You know, so you have to start rethinking your brain, readapting, and I would be prepared or try to be prepared. And having said all this, I did not see any extraordinary changes in what I saw and experienced in India in terms of hemorrhage. It just all was the same. Yeah, that's what I wanted to say about the blood
Yeah.
clotting.
Yeah. Thanks. I just have one doubt. I think the normal hemoglobin standard that the medical world uses is mostly based on the statistics of Caucasian population. I'm just curious that in all these years, have they taken into account the racial difference of Asian and African women, which have kind of different hemoglobin standards going on?
Yeah, there
I
are.
don't know.
There are
Yeah.
studies. These studies are coming out now across the board in a lot of things, because indeed, what started off, you know, you look at medical science, the history of medical science, it kind of comes out of one area ish, and they use the same population of people to test on. And it's very interesting and important and relevant. You know, when I was doing research, I had to look at these things. That was part of our requirement. So what I had to do was, you know, you didn't just read a paper. You looked at the paper, you go to the bottom, find out what the bibliography, where did they get their statistics from, their information from, what research was done. And then you go to the research where you have to go through the bibliography and look up everything they did and find out what that test was. And you can find ridiculous papers that get published with a study of 25 people. Now, that doesn't really give me anything. Yeah. And the general standard of what is normal is a test of 100 people. You know, I mean, there's a lot of people in the world, and there's a lot of kinds of people. And if I'm going to be living in, oh my God, Agnes water, and try to test 100 people in Agnes water and tell Indians that you have to meet these standards, how ridiculous is this? But this is actually what a lot of research is done on across the board. So this question is now being raised. They do recognize, yes, most of these tests, and it depends. Sometimes they use the other way. Many of them are done on well-nourished Caucasians in UK or the US. This doesn't, and it still doesn't fit the Caucasians in South Africa, would it? I don't think. You know, you got to have a different environment, a different culture, a different lifestyle, different food, different water, different air, different everything, different stresses. All this shit plays a role. So that nowadays they've twigged. They haven't figured it out yet, but they have worked that, yeah, you know, this doesn't really work, to come up with one statistic and information, and this is the golden zone for everybody in the world. So, and it does,
Yeah, but
for me, it comes
like
back. Say.
if they're doing it now, it's gonna take 20 years to convert it into the practice.
So when
That's what.
yeah, that's why I
Because
think
doctors,
we have to come from
they will always.
inside. Exactly. And they believe it, you know, they are, generally speaking, you know, okay, we talked about the CVE and the replies from the doctors, and all of these doctors really believe, they believe heart and soul that these numbers are the words of God himself. and as such, they are the servants. They are the soldiers of God. And there's outrageous statements in there of it's true. There's these outrageous statements in those things where the doctors, these guys, these men are saying, when our patients go into labor, we're in labor right along with them from the very beginning. Bull freaking shit. You guys don't even show up. You guys don't show up. What the hell? You're in every country. It's madness. It's madness. It's madness. There's a wealth of misinformation that's held up in these incredible fat books that you pay choke money for, and people believe it. And Tapasi, you're right. The point being is that information is flexible. You cannot write a manual for nature. You will never make a human being can never write a manual for nature. So remember this. You go everywhere you look for information, but always know God's playing with you. He's having a great time teasing you with these books and doctors. Because really, he didn't read a single one of those books. And Mother Nature is doing whatever. They kind of laugh. They're just having a really great time with us. So Tapasya, what's the answer? Your heart and your internal wisdom and your pray. Oh, Mayapur. and your I feel like this is a spiritual thing. In my culture and in many cultures, what you do is your act for God, right? It's your service to God. And there's spirit. Everybody has spirit, and this is how we connect. And this is, so there's many cultures that connect their occupation with God and with service to humanity. And what doesn't say it better than midwifery. So I have an internal dialogue of questioning, so I don't have answers. I'm sitting at a birth, and every birth is different. And you actually just don't freaking know. You will never know till the baby's out and the mother's holding it and it's suckling and it's not yellow. I don't know. You know what I mean? You just don't know. Ever. I don't care how many births you've been to, you will never know. And this is my spiritual path. And because I'm talking inside to something, and this is guiding me. And I don't think we have a lot else other than sharing our stories with each other. And that's how I know anything too, is by listening to stories of other people, other midwives who went before me. And you listen to their stories and go, oh, right, I remember hearing about this. Yeah. And this is really where the knowledge comes from. It's the women sharing. This is it. This is it. This is the true knowledge. The women sharing our experiences. It is not going to school for 7 years. It's women sharing their experiences with each other. Yeah, that's how I feel. Yeah. And I think that's what will always be the guide for you, Tapasya, because the research, I don't just debunk research. I read research. I studied. I did study hard, but I'm at the same, and I look at this partly because, we do have to deal with these people. We do have to speak. You don't have to speak the language, but whenever you're in the circle with the doctors and the medicos, I don't know about you, but I already feel like trailer trash. I already feel like the idiot. Yeah, these guys walking up with their suits. But it's true when you look to them. They They're like this, and I already know I don't know shit. The truth is, I'm smarter than them because I know I don't know. They're so stupid. They think they know. They don't know anything more than me. But and in spite of all that, I walk up to them and their egos and I cower. So it helps to know the language. And if you can say, if you can name that proper tail, the femur bone, or if you can name that proper joint instead of, the tailbone, or the hip bone, or the funny bone, the twangy thing. I like calling it the twangy thing. The thing that the women twang on. It doesn't go down well with them, though. They think I'm really dumb.
But that's what my teacher says, Vapio. She says that you need to have the mystical intelligence, the inner wisdom, but we study anatomy and physiology in their language because we need to speak intelligently in presence of the people who understand that language.
Yeah.
So yes, it's both the things are important in midwifery, like your inner wisdom and understanding where people at and meeting them there.
And it's also a tool. It's a tool to disempower, to silence women and anybody else. These are tools, right? These are all tools that are used. So, and needless to say, if I'm coming up to a doctor in this kind of situation, so he wants to silence me. He wants to do what he wants to do. Doctors are like that, right? They've got this is how I do it. I'm like that too. Sorry, this is how I do it. So, and now I'm in their house. This is how we do it. I think one day I would like to be able just to speak as I speak, because the way I speak is how your women speak. And that's how you can connect with your women, is speaking like the lay person, which actually is how people often connect with me, is they recognize I am a lay person, meaning I'm with them. I'm not above them. I'm lay.
Yeah. Okay, so shall we move on to this next story? Sabri, you had a question. You back? Okay. I mean, she's still on that call. She had a question, so I just wanted to finish off
Me?
Yeah, Heidi. Yeah.
No.
Okay. Okay. So the second mom was, she's an acrobat. Her husband also is an acrobat who works in the circus and prepares things for the circus and shows. He's a part carpenter and part acrobat. I mean, they do everything related to gymnastics and stuff. Amazing people. And they have had their first home birth with my preceptor midwife and another midwife. She used to work as a team. So her first birth was really difficult. It was almost 2 days. Her labor started on the first day at 5 o'clock and it ended on the second day at night at 9:30 when the baby was born.
First baby?
First baby. And she had almost a second-degree tear. She passed out. She had to be given IV at home. Because they were licensed midwives, they are allowed to carry IVs and Pitocin here. No, they cannot carry Pitocin, but normal IVs for dehydration and stuff they can, and they can suture. So the first birth experience was not optimal, but she was happy that she didn't transfer, and at the end she had her baby at home. Her husband is very kind of anti-system. He never goes to a doctor. He won't take a pill. He's like, I would die before I go to the hospital. I'll say, okay, fine. Okay, that is the mindset they are coming from. So the second time they're pregnant, because of the pandemic, all the acrobat shows and everything is cancelled. So they are in a really economic crunch. They cannot pay 90,000 pesos, which can come to around like $1,500 maybe in Argentine currency. So they are not able to pay that money to the midwives, and she's doing an unassisted birth. So my midwife, so she calls her and tells that, will you do the birth certificate for my baby? And the midwife says, yes, of course. I mean, I'll do the birth certificate, no problem, even if you don't hire me, because we have good relation. And because my midwife knows that I work as a doula at free births, I take free birth clients, because most of the doulas here in Argentina, the way they are, there are some, but the most of the mainstream doulas, they won't take an unassisted client because they think it's too risky.
Mm-hmm.
And they don't have enough skills to manage that. And that is why I'm studying midwifery, because I don't want to be that doula who says no. I want to be the doula who says yes.
Yeah.
And then she refers my name, that you just call this girl, maybe she would like to meet you. And I call her, and she comes to my house. We meet, and I just fall in love with, like, the whole story she tells me, and what she thinks about birth and stuff, and why she's going unassisted. It's not only because of the money, but also because she says that I want to see this time if my body's wisdom works without any help. So in the prenatals, what we discuss is, I never take her BP because she doesn't want that, because she's anyway following a care whatever her medical insurance permits. So she's getting her prenatal checkups, the 2 ultrasounds in the whole pregnancy that she got, and stuff like that. So she's getting it. So she doesn't want me to do all this stuff. No taking BP, no listening to the baby, nothing clinical she wants. She says, I want you to, like, I tell her that the way I work is, I nurture the women. I want to know about you, your family. I want to meet them every week, because she already meets me at 30 weeks. So I just wanted to know them as much as possible, because in an unassisted birth, that is most important thing for me, to know what kind of support she has. So it's her main support is her husband and her 4-year-old boy. The family is very supportive, but she doesn't want her mom there because she knows that mom will panic at anything. So, but the mom is very supportive, very loving. She brings food, brings clean clothes and everything. So she wants the mom in postpartum, but not at the birth. And all we do in our prenatals is talking to the baby, getting to know each other, and doing a meditation at the end of every prenatal. And in a prenatal of 36 weeks, I gave her a little massage and gave her a face mask, and that was like beautiful, like made her a flower crown.
Yeah.
So like just treating her like a queen, and she was really happy with that. At 38-week appointment, we do this birth affirmation meditation, that she trusts the team, she trusts, and creating the sacred birth space. That is one of the meditations I do with my clients at, like, after 38, 39 weeks, that you have to create this sacred birth space in your physical environment and in your inside. So you imagine yourself surrounded by the bubble of white light, which is protective, and your family surrounded by love and trust. That is the stuff that goes on in this meditation. And it's really effective because it kind of creates that, that cozy place in your mind and the physical space you are imagining where you will birth. So, and then she was just waiting. The baby was pretty down in her pelvis. I palpated her a couple of times. The head was pretty engaged. She was just waiting. At 38 weeks, she said, just one more week, this baby is going to come. She didn't. I was on alert all the time. She completed 40 weeks on 4th of April. And on that day, I offered her, let's do a massage. If you really want to get this, get the labor going, I can try a couple of acupressure points, but not more than that. Like, I don't believe in natural induction, because there is nothing like natural induction, because if the induction works, it's not natural. And anyway, we don't have any time limits. We don't have a doctor to tell us what to do, so we are doing it on our own. So yeah, so she messages me back that no, maybe we are meeting on 5th of April because I've been leaking liquid. I said, great. So what are you seeing in the liquid? She's like, it's odorless, colorless, and it's trickling when I'm standing, but when I'm in bed, it's fine. I said, okay, great. Take rest, hydrate yourself. And she said, I'm having a couple of contractions here and there, but they are not regular. So the whole of the 5th April goes on like that. At night, I have told her that I sleep from 10 p.m. to 4 a.m. So if she wants me to go in that time, she needs to call me, because I won't be checking my messages. And sometimes I won't hear the beep in sleep. So that baby, I am so thankful to that baby that she didn't call me between 10 and 5. I got up at 5 with her husband calling that her contractions are regular and come, like they are every 10 minutes, but they are pretty intense. So I said, yeah, okay, fine. I got ready. I got a taxi, called a taxi, went there. By the way, my midwife lends me her birth stool, which I put the photos on the group. I'll be putting the measurements, because I just love that stuff. I mean, just love the birth stool. And imagine if a doula carries a birth stool to the hospital and tells, she can birth on this, and you can watch from inside, and maybe some say yes. Who knows? I mean, that's true, Instead of fighting that, let my client, birth in an upright position, take that stool and show them, because they don't know. They haven't seen a birth stool in their life.
Exactly.
Take them to the hospital and show them, yeah, this is the stuff we birth on. And yeah, if the doctor says yes, yay. And refer
the doctors won't do that, yeah. The doctor's back is very important. He can't bend over and be on the floor, and no, that's not comfortable.
I mean, it's just ridiculous, isn't it? There's the woman in labor. She's having the contractions. She's going to push this thing out. She's the one doing the acrobatics, and the poor, oh my God, the poor doctor has to bend over to see it. See it. I mean, you can't have a baby if I can't see it, right? What do you think you're doing?
Exactly.
Maybe in big hospitals, they have their protocols, but in India, you have every kind. So you will have a small clinic. Maybe once you show them that this can be done, because knowledge is a tool. Yes. I mean, most of the doctors, if they don't know it, and if they see it once in their life, maybe it will change their practice.
Absolutely.
You never know.
Absolutely.
So that is, it's a very good tool that you can always take to births, like find a carpenter to do to make your birth stool. Yeah, okay. So I go, her contractions are regular. They are managing it very beautifully. The candles are there, the music is there, the aromatherapy is there. I'm in so love with the environment, also because it is giving good light for my camera, because my camera is pretty good with light, not with low light. It will give blurs. So I'm so happy that the television is on, where they are playing their music, and it is giving me the light to take photographs. Usually I hate television on at births. I absolutely hate it.
It is lame. Yeah, it's pretty lame.
But it is. Sometimes the clients, they want it. Okay, fine. Sometimes I'll just cover it with a sheet so you can listen to the sound, but not get distracted, because the images distract you. If you are going to travel into those alternate states of consciousness, you don't want the distractions.
Unless it was the Jungle Book. I had one birth with because I think she was 3. The other kid was 3. And
Yeah, the kids.
yeah, so we were playing Jungle Book and Disneyland's Jungle Book the whole over and over and over again. I think we played it 6 times.
Wow.
But I always knew all the songs.
Yeah, if the kid is there and if he's blue
Yeah.
and he's not going, let him be.
Yeah.
But I went at 5 o'clock and this kid was thankfully sleeping. Then her contractions got really intense. They were not like textbook every 5 minutes, 6 minutes, maybe 10 minutes, maybe 6 minutes, maybe 3 minutes. They were all over the place. But I could hear the sound she was making and I knew that she's progressing well. This woman does not want a single pelvic exam, no vaginal checks during the labor. And I'm not a big fan of them, so I am not bothered. I'm just busy taking photographs, giving her massage, moaning with her, doing some om chanting continuously. And that's what we are doing. Then she gets into the shower. She takes a lot of hot water on her back, which makes her feel good. She comes out, goes in her bed, covers herself. She could nap in between the contractions, and she was eating continuously. She was throwing up, but she was taking some honey, some fruit juice, some fruit continuously, and I just loved it. Like when women eat in labor, that's the best thing. Yeah, some women won't. Whatever you do, they won't take anything. But some, yeah, because she had this experience of really, really long labor from in the past, and she couldn't eat, and then she had to be given IV. So she just didn't want that. And she had geared herself that she's going to replenish her energies all the time. Then she's in her bed. We are massaging her legs and feet and her back. Her husband is with her. Then the kid gets up and he's little lost. So I take care of the kid for a while. Then the husband goes and he gives him to the breakfast, everything, and then I'm with her. So it like the team effort played out pretty well. Then she says, I'm pushing. I've said, yeah, fine, let's do it. She tries pushing in a couple of different positions. And then I say, do you want to sit on the birth stool? She says yes. She tries pushing on the birth stool, but she's feeling like too exhausted and uncomfortable. So she again goes back to the bed and start pushing on her sides. And I thought, yeah, that is fine as well. She's lifting her leg up like instinctively. And sometimes we are sustaining that leg because she's getting tired, but she wants to open. And then there was pretty much long gaps in the contractions where she could really sleep nicely. I mean, I could hear her snore and then the other contraction is coming. I mean, it was absolutely beautiful. I mean, totally undisturbed birth, which you call. And then she suddenly goes on her all fours and starts pushing, and we suddenly see the baby crowning. I mean, it's there, and I could see the yoni opening, giving out the way, then closing back, and we are just telling her, go with the contractions, everything is fine, go with the contractions. So she's pushing with every contraction, slow and slow, and the head little by little comes out. I'll share the videos. And when the head is born, she touches the head, and I mean, it's crowning, she touches the head, and it's out of the world feeling for her. And the head comes out, the husband is crying, and I'm telling him, you want to catch her, you better wash her hands. So he quickly goes, washes his hands, and comes. She's pushing with the contractions slowly on her all fours, and the baby is born. 3 kilo 900 grams, almost 4 kg baby, a baby girl, pinks up immediately, gives out a loud cry, and we are so happy. We are not bothered about if she's breathing, the heart tone, the muscle tone, Apgar score. I'm not doing all that stuff. And the most amazing thing was the dad caught the baby. She has two cords, two wraps of cords around his neck. Nobody had told him what to do. He instinctively removes them. I'm just on the camera. I'm not touching the woman. It's the family which is managing the birth, which is, they are doing everything. The woman turns, we move her back, her leg over the cord, we give her baby to the chest, the family reunites. It's an amazing, beautiful video. You must watch. I'll be sharing it soon. Once I share with the family, they are okay with me sharing it with the world, because most of the clients of my clients say, okay, we have watched the YouTube videos and they helped us a lot, so we want to be that people now who will be divulging the information, and we would love to. So most of them except one have permitted me to share the videos. And then the only thing was she was having horrible after pains, and I have read that second time onwards you have more after pains. So I want to ask KL about that. That is one point. Then in the first birth I had attended, she was a first time mom, but again she was having really painful contractions, and we were just waiting for the placenta. And the midwife at one point said, okay, get on all your fours, and maybe you need a little help, because maybe the placenta is all balled up and it is not going out and you are kind of exhausted. So let me give it a tug. And she gave it a gentle tug, and placenta, the whole came out. And then I asked her, do we need to do that? I mean, and she said, Tapasya, look, everything is not theory. I mean, in theory, you shouldn't tug on the cord, or you shouldn't mess up with the placenta or whatever. But you have to take your judgment. If the woman is in pain, she wants to breastfeed the baby, but she can't because the placenta is not out. She's very it's not possible for her, and she's getting kind of desperate to get this placenta out and let me finish with the birth. Then you can, I mean, you should actually offer her help. If she says yes, then yes. And then she showed me how to do it gently, not the way doctors do it. And I made a mental note of that. And in this second birth, again, she's having really painful contractions. Still we wait. She applies some CBD oil, if you know the marijuana oil, the marijuana seeds oil. So she applies it on her tummy. She takes a couple of drops inside. So she's having some pain relief. We are she's breastfeeding the baby, I mean, the bonding is beautiful. So I just leave the family to bond. I do the other cleaning stuff. So like that, 2.5 hours pass, but the placenta is not coming out and she's still in pain. So after 2.5 hours, I called my midwife and asked her, what can we do? So she said, let the cord be attached and let her change the position. So I said, do you want to change the position? He said, yes, but let's cut the cord because it's already limp. I'm sure my baby has got whatever she wants. It's been 2.5 hours and I really want to get up and pee. And I said, okay, if the woman wants to pee after the birth, great sign. Let's do it. And we cut the cord. She's little lightheaded, but she's eating chocolates and getting her fruit juice. And we got her lying down immediately after the birth. So she was getting into her senses again. And finally, she was able to compose herself, get up, go and pee. And I said, maybe you make some effort on the toilet to push out the placenta with the contraction. Maybe that will help. She tries, but nothing happens. So she comes to the room and she says, let's try the birth stool. She sits on the birth stool. with contraction, she pushes and a gush of blood comes out like, psh. Okay. And the pad we have, it is all, but it's not that much, maybe 10 ml, I would say. Then she pushes again, but she doesn't have that much strength. So after the third push, I said, do you want me to give you a little tug on the placenta? She said, please get this placenta outside. I want it inside. And I said, okay, you make a mental prayer. You kind of give the thanks to the placenta. Thanks for nurturing my baby. And now I want you to come out. Please come out. She does this ritual. And then I start pulling the way midwife showed me, that pull backwards towards the anus, not in the front. So I start, and a gush of blood comes out, and after that the whole placenta balled up comes out. Everything is coming out, but one side of the placenta and the membrane is still attached. I don't know where. I mean, is it stuck in the vagina or to the uterus? I don't know. I catch the placenta in the bowl. I keep the bowl like this, but this thing is still attached. So I don't know what to do. She's pushing, but it is not coming out. So I said, do you want me to tear up that membrane so that the whole mass comes down and maybe the second thing will come out on its own? She said, yes, please do that. And I don't know, that was the moment. I don't know if that was right or wrong, but I had to tear that membrane that was sustaining what piece, I don't know, and got the placenta out. It comes with lots of blood clots, like big blood clots and blood. So now I know why she's not bleeding with the detachment of the placenta, because the placenta is blocking the blood inside and it is getting coagulated.
Which is why she's having painful contractions.
Yeah. And so when the placenta comes out, her pace goes really, really down, like from 1 to 10, now it's at 2. And until the placenta was inside, the pain was at 10, if you compare. Yeah. Then she's still having the contractions, but bleeding has stopped. It is the normal bleeding, the postpartum bleeding, but there is no trickle, there is no continuous bleeding, nothing. So I gave him 10 drops of Angelica root to see if whatever is attached and still inside will come out. But it still didn't come out the 2 hours more for which I was there. So I left her the bolso de pastor, the shepherd purse, and told her that if you bleed more, you take 10 drops of it, because it's the antidote of Angelica root. And she says yes, but she didn't need that afterwards because she didn't bleed that much. She peed a lot after the birth. She was not able to pass do the bowel movements, but she peed. The baby was fine, everything was fine, and I came home. But I was constantly thinking about these two things, like what happens to that piece which is staying inside. My inner wisdom tells me that the body will get out whatever it doesn't want, and one thing she has to do is keep like the hygiene and monitoring her temperature maybe for a week. If it doesn't come out, that would be alarming. But other than that, I don't think the body is going to retain that piece for long. It will come out eventually.
Or reabsorb.
Reabsorb, I don't know.
Yeah, it'll do one or the other.
The thing is, I don't know where that piece was, in the uterus or stuck somewhere in the yoni, because she wasn't feeling the pain when I cut that membrane, like tore it with my finger. She wasn't in pain.
Right.
Like it was not really tugging on the uterine wall. It was stuck somewhere with the blood clot, I guess, because there were many blood clots. But again within the range of
The membrane
normal.
coming off the wall doesn't hurt. And it is,
Yeah, no.
if it's sticky, you know, okay, number one, when the placenta comes, what you can do as the whole thing comes in it, and this often happens, you know, it turns inside out usually. You've got the shiny side coming. So the fleshy bit comes out like a lump, and then you just have like a jellyfish. You've got the bits of membrane stringing afterwards. So the technique usually is when the placenta comes, you take them and start twisting it, right? So what you're trying to, yeah, you're turning, and as you twist it up, you're plying the membrane, because the membrane does, you know, it's just the sheer thing, and sometimes, yeah, a bit of it can actually stick to the uterus. So by doing this, it kind of plies it, makes it tighter, and then it comes away better. But many times you will often see bits left behind, many times. And usually what will happen is it'll come out in the following, usually within 24 hours, it'll come out with the blood loss, the lochia. I will tell the woman this may happen, you know, if let me know, or even set it aside, I'll have a look or whatever. If it doesn't come out, they tend to reabsorb. But yes, prophylactically, I would keep an eye on the temperature, and of course, you're going back regularly to check. I go back every day for the first 3 days, and then I have my routine.
Yeah, I'm going to be 32 hours. Yeah.
Yeah. So I'm going regularly. I'm checking their blood flow. I'm looking at them, and I'll keep this in mind. That's right. Something got left behind. Let's keep an eye on this. In terms of what you're saying about the third stage at all, so a couple of things. You mentioned the painful contractions, and yes, over time, the placenta, generally speaking, before it comes out, will actually block off blood flow, and of course, the blood will start to clot, and as these things start to build up, you know, you've got your placenta, and then now you're adding more and more blood that's clotting up. Yeah, it becomes painful for the uterus to contract.
And I'm hitting the uterus, and it's not coming back to size really soon. Once the placenta comes out, it comes to a grapefruit size, but not the orange size, which it is supposed. So it was two fingers above the umbilicus, and it was squishy, not very firm. So I stayed there till it was a little firm. So now
this is after the placenta?
Yeah, after the placenta.
Yeah, okay.
She's not bleeding too much, so I'm not worried about the atonic thing. No. Her uterus is contracting, but not in a theoretical way. Like I have read that it should be orange size, like grapefruit size, then orange size, and then it goes back into the pelvis. That will happen in 2 weeks. But what I want to see is that today her uterus is firm, and it has come to at least to her umbilicus, and that's what I would expect.
Yeah.
What is your take on that? Yeah.
The same. Well, I would, before you leave the birth scene, you want to make sure she's, you know, that's the last few things you're looking at. You're checking the uterus contraction and things like this, and making sure, especially if you had an issue with any blood loss or bleeding. It seems to me, though, I would have, as soon as the placenta came and everything came out, everything responded normally. From what I understand, that the contractions were good. So from that point onward, the placenta's out of the way. I know the problem's solved. You know, now she will contract, and I'm happy with that. And yeah, I'll just check on it throughout the days, but it'll no longer worry me as long as I see, oh, good, she's contracting normally. Now, as far as the size, you mentioned something like grapefruit and orange. Now, all I'm familiar, this is what I'm used to working with, is after the birth and after the placenta, you will find that the uterus is around the point of the umbilicus. And as long as it's contracted and we don't have any bleeding, I'm happy with that, and I'll go home. And then basically every day it's supposed to drop a little bit more and a little bit more by finger. And I'm paying attention to this. And I really haven't had, I think I might have had one person with an issue with this, and I'll have to meditate, try to see if I can remember what happened. But really, I don't, other than that, I've never seen an issue with the shrinking of the uterus going back to size. It just does. But you mentioned afterbirth contractions. Hell yeah. Hell yeah. I am not a fan of afterbirth contractions. I will state right now, they suck. They suck. They are not nice. I hate them more than labor. I will go through labor more than afterbirth contractions. I have freaked out my clients who came by to visit me afterwards. And you just, oh my God, I'm sorry, I'm a mother of 5. I've had many kids and I'm not, once you have, when you're first kid, there's angels and fairies all around you. By 5 kids, it's blood and guts and kids in between your legs and annoying you. Not just the one you just gave birth to either. So, you know, you have these pains, the contractions are insane. It's, you know, when you have a baby in there and there's a contraction, I think the baby absorbs some of that pressure. And when the baby's gone, you've got nothing. And it's contraction on contraction, and that thing hurts. And what's the next thing you got to do? Put your baby on your nipple. Oh my God. You know, again, it doesn't matter how many kids I've had. My nipples crack. They hurt. Toning them up and getting used to it, it's a painful process. You know, those first 2 to 3 weeks suck when you've had 5 kids. There's no.
And the baby kicks on your tummy, so that hurts more.
Oh,
The baby will kick. She has the reflex, and this woman was like, "It hurts. No matter how much I love her, she's kicking me in my stomach, and it hurts. Get this placenta."
Yeah. And I'm talking.
You know, I'm a very like undisturbed 3rd stage, but it was kind of, if she needs me and I'm there, I should help, right?
Absolutely. This is her birth and she's asking for it. And frankly, again, this is for me, because I've had so many kids, I approach birth differently. I'm an animal. It doesn't mean, actually, it's nothing to me. It's cooking dinner, right? I have kids. I'm cooking dinner. I do the laundry and I push out a baby and I pick up the blood clots and I breastfeed somebody and I go back to cooking and help somebody else with their baby. And really, that's all it is. It's just a blood and guts ordeal. You know, I listen to you, Tapasya, and your meditations and how you work with your clients. And I think I would be one big pain in the ass to you. I don't know what it would be like. Sorry? Just because politically, no, I just don't. I don't think I go into that precious space for myself. You know what I mean? You create a special place and the women get, like you were saying, how you nurture the women. I don't know if I could handle that. I don't know. Nobody's, you know, apart from my mother when I was a little kid, I don't think I've had a nurturing such as you're speaking and such as I give to others. And to make me queen of the day.
No, it's not for everybody. It's not a standard that I do with everybody. It just, your intuition tells that this is your kind of person, the meditation type of person. Go with that. If that is a very physical kind of person, let's make her physically good, you know, gift her chocolates or whatever. I mean, make some good soup for her.
Yeah, I'm just thinking, remembering things and stuff of people around my birth, and it's just it's really practical, you know. It's, You got to keep the kids away, because I always had a house full of kids, and if it wasn't just my kids, I had other people's kids living with me. I had up to I had an ashram of 8 girls who were hanging off of steps and in the windows and off the staircases. I could see their heads hanging down over the top of the roof because they were looking down over a staircase. Just 3 hanging heads watching me give birth. And it's very, to me, it's a practical issue. So anyway, just back to the afterbirth control, or the whole thing. You're talking about helping this woman. Absolutely. She needs the help, and she's telling you this, and it's humbug, right? Here's this, you've already had your baby. It's just a placenta hanging in there. And you really want to get on with the rest of your day. And the placenta can it's just an annoying inconvenience, let's kind of say. I know it's different. Like Gori will tell you, she has lotus births where they've never cut the placenta. And many people do this. And it's a real sacred space for them. It's a really precious, sacred, healing space that's as precious and sacred to them as the birth space. So when I'm saying something a little bit different, quite different, get it out of me, I need to get to work. But people approach things differently. And so, yeah, I need to get the business done. I personally don't have a problem with my placenta. It comes very quickly. But I do know some women who it gets in their way. They want to have it there. And many women just want to get it out of the way. And they're a little agitated until it's gone. Do you notice that? They're a little aggro, a little edgy. And finally, when it's out, they're like, oh, every woman does that, right? Oh, thank God it's out. They're so relieved to get it done. There's something about it. They want it out. So what you say is true. You're applying downward pressure, not upward, because if you go upward, you're pulling it up against, everything's a little floppy in there and displaced. So if you pull upward, you're going to go across a very tender urethra, clitoris, and potentially abrasions. And labial tears are never pleasant, so you don't want to go that direction. You want to go downward, as you say, to the floor or anus. And what you can also do is get the mother to do it herself. And she can work with that. Sometimes I've tried to let them do that, but I do find a lot of times in things like this, women are very happy to hand over the work to you. I don't really care, just do it. But anyway, you could offer them to do that for themselves. And I wanted to say something about your athletic couple. I have found that athletes, especially if it was their first child, it was a bit of a challenge, because for an athlete, they're the boss of their body. They make that body work. And they're really into their body. They're really into this. And they want to be, they push themselves. They stretch harder than their body wants to. They run longer than their heart wants to do. And they're constantly pushing their body. They are in control of their body. And it takes a bit of time for them to let go. You are not in control of your body. It's the worst thing you can do is to try to control your body right now. I know you keep pushing it. I know you're in charge, but right now you are not. And I find it a mental challenge for athletes to go through labor. It's a mental challenge. They can do it, but that's their trick. And the other thing is because they're so fit, their muscle tone can be a problem. You want soft, you want juicy, you want rubber. You don't want iron, which is what they want. Yeah. You want to be muscle. I want to be iron right now. Oh no, do not do this. You want soft. And it's totally against their head. Yeah. It's totally against their headspace. And women getting fat, getting floppy, getting juicy, right? I never had this. It becomes a challenge. And for people who are into their body in any way, it's a headspace, and it's a challenge that they, in your meditation, that would be a meditation that you might consider thinking of, that you need to let your body be in control now, not you. As a thought.
Yeah. That's what she told me when she processed the first word, that I'm practicing the letting go, the surrender, the stuff.
Yeah.
And one more question. About the delivery of the placenta. Now I know that I should have turned a little bit, like, and try to
And
get the
seesaw. So after you twist it, and it's coming downward. And again, always, Tapasi, you're always going to tap into your intuition and your kinetic feeling, right? Here you are, you've got a placenta in your hand. You've twisted it up. And as it comes away, you're going to feel, if some membrane is sticking, you will feel the tension. So you will feel if it's to the right, to the left, it's up or down. You'll feel where it is, and kind of jigsaw. You're just kind of sawing it, moving it up and down, trying to get it to release. But again, usually some little tear, maybe some little bit be left behind. No big deal. It should be fine.
Because I examined the placenta when it came out. It seemed like two cotyledons were missing, but
Oh.
I don't think it, like, because it was totally round, and the thing I was thinking that this is missing, though, that was the side where the membranes and the bag was.
Yes.
So, and if the cotyledons were missing, I don't think she would have felt pain, but she was not in pain. So
Well, she
I
would have
think that was
bled
the
too.
she would have bled, but she was not bleeding excessively, and she was not in pain. So now I kind of realized that maybe just a piece of membrane stayed in there, not a cotyledon, because it's not possible that because the whole placenta came out in one bit, and it was kind of hanging from a membrane, and I don't think one whole cotyledon, because it is stuck to uterine wall.
Oh,
So
okay.
how can
So I'm not sure what what made you think that one of the cotyledons were inside? You said two? What, you said you examined the
because
placenta.
example placenta, it was not the perfect cake.
Okay.
It was like a slight bit of there was, I thought it was missing, but then that was the side where the membranes and the bags extended, because
Okay. Yep.
that is
Okay.
how it. So I don't know, and I'm still thinking whether to give her a dose of caulophyllum glucohosh, maybe, if she hasn't seen anything passing, or let her body just work, because I'm sure that the body will get out whatever she doesn't want.
Well, one thing too, when you look at that, sometimes you will get a shape like this where something doesn't, it looks like there's a dent, let's say. But what you really look at is the membrane. How do I explain this? Not the membrane, at the edge. When you look at, you're looking at it inside out now, and you're looking at the red bits and the cotyledons, and as they stick to the membrane, there's like an edge to it. I don't know how to explain it, but you should be able to see if something is, you'll see a funny spot. It's been pulled out, right? Something's missed out. So you'll see a spot that something should have been there. Otherwise, you'll have, it'll actually be smooth. You won't have bits that look like a part of the placenta stuck to it. and where the gouge, where you think the placenta should, the cotyledon should have been, you'll see a nice smooth edge to the existing cotyledons, which imply one was not pulled away. If I had a fresh placenta, I could show you. But the next time you look at a placenta, have a good look around the edge of it. Here's the meaty bit. Look at the edge. And where the placenta meets the membrane, there's some sort of lip, if I can say. And so if you find that lip goes into the gouge, then nothing pulled away. But then if you find, there's a rip in the lip, you might have an issue. Yeah. But if you
I don't think there was a rip in the lip, because I have handled almost 6 fresh placentas and always they were perfectly round.
Yeah.
And then this placenta also, I processed it for making the tincture and making a milkshake. I mean, the placenta shake for mom, and keeping rest of it in freezer. So I did process that placenta. I took out all the cotyledons, but where the thing was missing, it was smooth. I didn't think something was torn out of it. I really didn't.
Yeah.
So,
yeah.
And what I clearly remember, that I was tugging on the membrane and not on a meaty part.
Yeah.
So the midwife later asked me, did you take the photo of the placenta? But it was really not possible for me to take the photo with all that mess. And I had to make the mom comfortable, get her into a clean bed. Her husband was really, really tired, so he just wanted to sleep. When I asked him to make the placenta shake, he made the shake with the berries and forgot the piece of placenta to put in the blender. So I had to do it again myself. And then I had to process the placenta, because I don't like to leave my placentas in the fridge. I just like to leave them clean in the trays in the freezer, so that mom can take out bits for her shake every day and process, like clean up the cord and the membrane, clean them, wash them, put it in a bag and keep in the freezer for later when they want to bury it and plant something on that. It was a lot of stuff, but I'm really, really sure that it was not a cotyledon that stuck inside. I'm pretty sure that it was a piece of membrane, and the mistake I made was not twisting the placenta. That didn't occur to me. I just tore it I tore off the membrane because she was in pain, and I just didn't want her to be in that situation anymore. The placenta hanging outside, and I was sustaining it in a bowl, and it was weird.
Oh, were you holding it like this because of the membrane? Oh, no, I would have done it straight away. Yeah, nah. No need.
I just tore off the membrane because I didn't want that to continue.
Yeah.
So I'm just worried about that bit of membrane. I'm pretty sure that was not a cotyledon that was inside, because the placenta wouldn't have come out that way, the way it came out, like the hole, because it would have come out torn, or she would have bled, or she would have felt
You don't know, because hard to say,
Yeah, I don't know.
because placentas are their own thing, right? A placenta is its own type of body. So they're different too, and they can have weak spots, and they come in different shapes, and usually they're roundish, but sometimes you get Australia or somebody who is no, Island, you would understand. Yeah, they just come in different
I know.
weird things.
So maybe I'll give her a dose of caulophyllum if she hasn't observed anything passing out. I mean, it's not been even 24 hours to the birth. The birth happened at 9:55 a.m. yesterday, and today I'm meeting her at 11, so it will be 24 hours, but like it's not that watertight compartment. So maybe I'll wait for her for 2 days, maybe to pass it. Like, I'm sure when she happens to have a bowel movement, something will come out when she because right now she just doesn't want to force anything. She's so tender, and so she's afraid
Yeah.
of in the bowels. So when she does that, maybe something will come out. I'm pretty sure.
I
Because
think she'll
why
be
would the
okay. These things happen regularly, and they
ready?
just,
She's fine already. Yeah,
yeah,
she slept. She went peeing several times, which was surprising for me, but she did because she was drinking a lot of water, and she's fine. The baby is sleeping fine, so I don't see a problem. Now I will see her. In today's visit, what I'm most concerned about is that her uterus is nice, tight, and around the umbilicus, and the bleeding is not something unusual. It's the normal lochia that we see,
exactly.
and that is all I want to see.
You
Everything
may
else is
see,
fine.
if she saves you something, you may see, in fact, sometimes I say, if you get something in your pad, you can leave the pad aside
Yeah.
so I can see it. If you think the membrane came out, something you might see.
So I want to ask you what, Kale, that should I go in today's visit to revise? I don't think that's a good idea though,
Revise.
because if there is a membrane still hanging in there or something, because there are chances that I introduce infection for nothing. Like if there is something, we want the body to take it out without introducing any new thing which will give her fever and stuff, and then she'll have to go in and get antibiotics. So I
Was
don't think
membrane
that's a good idea.
hanging out?
Yeah, because I tore the part and
Oh, you tore it off the placenta rather than pulled it from her.
yeah, because
Okay,
I didn't want to,
okay.
because I didn't know where it is attached, and if I pull something she might bleed, so I just tore whatever was remaining and got the placenta out.
Okay. In the future, you
Yeah.
don't need to, the membrane will not cause bleeding. It's not like
Okay.
the placenta. The placenta, the reason why they're bleeding, the placenta grows onto the uterus, placenta straight to the uterus, right? It's making this connection in blood vessels. That's what that is. The membranes just kind of stick.
Yeah,
they're just a
they
water balloon that just kind of, if you get cellophane against you, it's kind of sticks it to your skin too, right? You just want to pull it off.
Yeah.
So it's like this.
Yeah.
So when it comes off the uterine wall, it will not bleed because it did not create blood vessels or a blood functioning thing. Only the placenta meaty bit will do this. So you'd be perfectly fine in the future to actually remove anything hanging out of her like that, because that can also lead to, you have something hanging out that leads to infection traveling up as well. So better that, and it's so easy really. It just, you just wiggle it a bit, and worst comes to worst, it tears a little higher up inside, but at least it's inside and not hanging out. And
no, it is hanging. It's not hanging outside of the yoni. I'm sure it tore up there.
Okay,
So
okay.
I
Then
know
no worries. No worries. It'll come. It'll just come.
No, I don't want to go in there now. Like, no.
Yeah, I wouldn't. I wouldn't.
Yeah.
For me, I'd only be looking down there. Oh, I guess I would have a glance. But if there's tears, I'm looking at tears.
No, she didn't tear. She didn't tear a centimeter, like nothing.
Then I wouldn't
Impeccable,
worry.
like,
I wouldn't worry.
amazing birth. You didn't tear, like 4 kg baby, and you don't tear on all your fours. That's what it shows, that what an undisturbed birth can do. Like,
Yeah.
how the physiology takes care of itself,
Exactly how the body knows what to do. The women know what to do. We're making a much ado about absolutely nothing.
And this birth kind of reaffirmed my faith, because I told you that my midwives generally do the vaginal check once they get into the house to know where the woman is and stuff like that. I didn't do it even single time. I had my Doppler with me, but the mom told, I don't want you to listen to the baby. She had told me, don't even carry the Doppler with you, but it was kind of maybe I carried it just in case. Just in case is one thing that we are always wary of.
Yeah.
And
yeah.
So she didn't want any monitoring, and the birth just flew, just the flow of it. And it was such a stark contrast. I mean, both the births were beautiful. In one, the midwife is going inside checking if there is a cervical lip. The other is kind of holding the woman, asking her to come out of water. And the second birth I attended, the woman is leading the birth. I'm just holding the space, supporting, taking photographs. That's all I'm doing. She is telling me what to do. She is asking me to get the placenta out, and she herself is telling me whatever is remaining will come out, right? I say, yeah, it will come out. Why? There is no reason the body should retain it. And like, and I
Yeah.
don't think it was whole cotyledon either. So it just stuck in my mind, processing. And then I came out of that, and I was really hungry, had a good lunch, had some wine, and just slept.
And dessert. I saw the dessert. I saw that ice cream.
Because I was so happy with that outcome and so excited. I needed something to calm me down. So like the wine jury,
Whatever works.
yeah, it calmed my nerves, and I just slept. And now I'm back at 5 a.m. here for the meeting, but I feel well rested because I had my 7 hours sleep, and now I'm going to see her in a couple of hours. So I'm really happy with whatever it was. I mean, it was the amazing birth, and yeah, fantastic.
And you learn how, actually, isn't it? That's what you, as a midwife, or the more and more births you go, the what ifs, a flag, a warning, what if, and then at the end of the birth, nothing. The flags go up, and I pay attention to the flag. I do, but okay. It just tells you, much ado about nothing. I did want to say something about that cervical lip and the coccyx, the tailbone. So sometimes some women just want counter pressure. You don't want to, you're right, you do not want to push that coccyx back in, but they're feeling it, they're feeling this. So all you're doing is providing counter pressure. So it opens a little more gently. But really, I think what was really going on there is that extreme, and some women won't get this, my back, my back, my back, my back. It's the cervix. It's the cervical lip. Okay, so then you end up in your conundrum. This is for every individual birth worker, how you're going to deal with it. As I said, that was Mexican birth worker didn't know what the hell a cervical lip was because she never ever put her fingers up a woman. She doesn't know anything about this, yet she's a knowledgeable midwife. And others will go in there, and the process of moving that lip is painful. It's not comfortable, and it's tight. It's a tough thing to do. It's quite a tough band. I don't know what's the right way or the wrong way. I've been, I get impatient too. I'm not perfect. I know it's a better standard, but sometimes I'm as impatient as anyone, and I got my finger in there pushing it back too. But yeah, if you don't have to, great. I just wanted to make that correlation. I just wanted to let you know about the back pain, that thing, and the cervical lip can go hand in hand. Okay, well, that was a lovely meeting, lovely topic. And if you guys are open to it, because I want to form something, a support network for women. I want to spread the real knowledge, get real knowledge out there. And I want to, and you're right, anybody who's going to stand up and speak the truth of birth is going to be attacked. The medical fraternity is big, powerful, strong, and built of many, many men. There's lots of testicles in this and testosterone. And where women talking about childbirth, which has nothing to do with the men, it's women's business. And it becomes this male fraternity struggles with us standing up. And the only way we can do this is if we support each other. It's not good enough for one person to stand up and speak the truth about, you have a right to ask your doctor to do something or not to do something. This is your body. And every doctor is going to
Ah,
stand up and attack you. They're not going to like it, but it's the right message. And we have to empower these women. And so I feel like we need to bring up a network where we can protect each other, that if somebody does stand up and says, no, you have a right to tell your doctor, I don't want to be induced, or I don't want, or I do want. You have a right to do this. You have a right to ask questions. And when the doctor stands up, and they will, how dare you? Who is this person? And they start an attack on that person. I want to be able to, for us to come together and go, oh yeah, no, we're here. We're a sisterhood. And yeah, you have, no, you're wrong. We have a right to ask you questions. You do not own my body. You are not in labor with me. You don't feel a goddamn contraction, buddy, Mr. Man. Not one. So we have to, it's the only way this is going to work is if we protect each other. And so I don't mind meeting one other day a week too, because I get fired up after these meetings and then it pans out. So maybe what other day, maybe I'm any other day or time is good if you guys
Or
can.
Friday or Saturday.
Yes, that should be
I'm okay
good.
with.
Either of those days is good for me.
Or we just move this one to maybe a Tuesday and another maybe a Friday. So we have.
Tuesday and Friday would work actually. Saturday, Sunday is like kind of
Yeah, it's bit
busy for us.
tricky for many people because they go out of town or something.
Yep.
But Tuesday and Friday should be fine.
Okay, well, maybe we can try Friday. Okay.
But like meeting the same people on Friday, or you were thinking about adding new people and
Whoever wants,
for a different.
that will be this, it could be a different group, because this one I do want to talk about birth issues, the actual childbirth and that thing. But another thing I would like to be able to start supporting, if dare I say, a movement. I want to start a movement of empowering women. Yeah. Shivani.
So Kale, what you're talking about is like on Fridays, what we can do is not only the birth professionals, but we can include mothers also in that meeting.
We can too. And, I used to have one of the groups, midwifery groups I was with. One of them, they were very determined, was very strong point for them that we, like meetings like this, we would never have meetings like this without a mother, just a mother, not a birth, not a doula, not a midwife, but a mother had to sit there in these meetings to make sure we kept the status quo, the voice was still pure. Not because I'm going to be very tainted with what I'm saying, because I'm coming as a birth professional. Even if I pepper in my own personal birth stories, still I'm a pro. So I'm not a pure mother. My kids agree. But yes, so I would like to do this other group. To begin with, I want to kind of bring in as many people in the field first, just to start the body, and then perhaps get out there with the information. And yes, I would like to spread the word out to women, to mothers, not just to pros, but to ultimately, we have to get out there, all of us, all those people, get out there and start speaking the truth. And when you start speaking the truth and you get attacked, we're going to be there. We're going to be there to help you. And also, this group should be able to extend their support and network to the mothers who are under the wire then, right? Let's say I'm being harassed. My doctor's telling me I have to do this. Then you know what would be a damn great thing? This is really what I see. I have done things like this before. I have been on the international podium opening my mouth. I am in connection with different organizations. And ultimately, what I would like to see is that we create a network that gets us support and sponsorship from these other bigger entities. And then when we speak up and say, yeah, you have a right to ask the question of your doctor, and the doctor attacks, we come back, excuse me, we have our own rubber stamp. We rubber stamp. This is a good doctor. I'm sorry, you did not get our approval, right? These are the practitioners. I want to have a body that has clout, meaning it has pressure to bear. I want to make, I want to bring pressure on doctors to behave themselves. I want to bring pressure on their heads. Behave yourselves. And this is the only way we can do it. Yeah.
But like,
Actually, I had a yes, Tapasya.
isn't Birth India community and the individual birth networks of the house, they don't have any clout, I admit, but they are also organizing and
Yes.
talking to it, maybe
Yes.
only on Facebook.
But
I
what
don't know.
the problem is, Birth India, again, they don't talk about doctors. Birth
Yeah.
India doesn't tell you, like, if tomorrow, if I'm only a mother, I'm not a birth professional, if I ask Birth India which doctor should I go to, or which hospital is doing which kinds of intervention, the Birth India doesn't do that. Actually, that was my idea for Pune Birth Network, but there were some people who were opposing this idea that we should not talk about doctors and we should not, but it will, otherwise it will not work.
That's, again, this is how
This
they
is not how
silence
it
you.
works. Yes,
Yes,
They
exactly.
make
that
you
is
This is not,
exactly
silence.
how they
and
silence you.
and it is going to take time. It is not that it's just a 1 day thing or 1 month thing or 1 year thing. It is going to take time, but we have to start it right now.
I
We have
totally
to
agree.
start spreading this awareness, because right, like I was talking to KL before the phone call which I got right now, that mom, she normal pregnancy, okay. uh, just on 31st of March, in her sonography, it was mentioned, the values are not mentioned, okay, but only one line, that the PI of the umbilical artery is higher than the normal. This is just one line which is mentioned. Values are not mentioned. So how can one identify whether it's on the higher side or it's on the lower side, or is it normal, without the values? Okay. Today, yesterday was a due date. Today they call her to the hospital. They tell her that your BP is high and get admitted today at 9 o'clock. We need to induce you. So I'm on the phone call with her and I'm telling her why. And this is not a valid reason. First of all, this is not a valid reason for
And also,
induction.
you said she was
So
-2 station, -2 station, and they're going to induce her.
yes, and 1 centimeter dilated. Again, 1 centimeter dilated. She had diarrhea 2 days back, so she is going to go into labor maybe within the next 24 to 48 hours. She called her Ayurvedic doctor also. He is also telling her go with what the doctor is saying. I'm like, are they aware about the Bishop's score? Are they aware about what are the valid reasons for induction? Are they aware about is the pregnancy lasts for 42 weeks, not 40 weeks? What? And the worst thing is what Tapasya was talking about last time is, the dad told me that, Chabri, they are telling me that we took a risk for 1 week, okay, 31st March to 7th of April, we took a risk. Now we are not able, now we will not take the risk, you will have to take a risk. I asked the dad, did they give you in writing that they had taken a risk for the last week? He said no. Then I'm like, today also, if you get admitted, if according to them, they are going to get a consent form signed from you, where they will be mentioning all the side effects and everything, and you will be signing it. So ultimately, it is you who is going to take the risk. So
From the
why do you
get-go.
want?
It pisses me off. These doctors need to be, and this is what I found in India, that doctors are gods. I mean, India loves its gods, and so they put their, and who wouldn't want to be a god, right? So the doctors want to be the gods. and Indians like worshiping them. And the fact that it's true, there is a psychology here. You have a culture. I travel a lot around the world, and I get involved with cultures, and your culture does get in your head. So India is there. They do have this thing about worshiping their doctors. I mean, not like puja, but you know what I mean. And this the
Yeah.
God Almighty, and the fact that an Ayurvedic doctor, an Ayurveda, an Ayurvedic doctor is going to say, is pulling back. Oh no, listen to the doctor. No, something's way wrong. That's wrong. Whoa, that's wrong. You
And the
know?
worst part is these people don't want to listen to us. They don't want to opt for a doula. They don't want to opt for a home birth. They don't want to like, but and they just and tomorrow if anything goes wrong, like they are going to blame us, not the doctors.
Yes, that's why we need a network. This is
Yeah,
why you
exactly.
need a network. Because exactly right, Sabati, they're going to blame you. If you speak your mouth, this is how abuse happens. There is a dynamic of abuse. There's actually a psychology and a play out. So a lot of this is abuse, and the way you keep it happening is by silencing people. Nobody's got the guts to speak up to this guy. What's so special about a doctor? Nothing. Nothing, but I mean, he beats fear into my heart. And even at my age and my experience, they do. They bully me too. I feel that bully. But that's why we must stand together. We must, women to women to women. We have to
Yeah.
stand together.
Yes.
We have to and shout
Yeah.
these things out. And
Yeah.
and because women actually want it. The women are seeking it. So let's be there for them, for us. So
I
good.
think
We,
that's a good idea. So we can do that. We can form a
yes,
support group.
yes, yes. And anybody
Yeah,
from
yeah.
Birth India, they can partake in it, but we are going to, I don't want to be wishy-washy anymore. I do not see the wishy-washy working. Um, not anymore. There's a way to do it, but we must stand up, I think.
Yeah, yeah.
All right,
The
ladies,
thing,
thank you so much.
yeah.
It'd be so nice. Oh, sorry, Tapasya, you were saying?
No, the way you said a few moments ago that you feel little less than the doctors when you are a midwife. In India, that is the fact. Even the Ayurvedic and homeopathic doctors have fear for the mainstream MBBS or the specialists. They will always, they say we have a lot of faith in our stream, but you better, be safe than sorry and go with that.
Because
Safe and
Ayurveda
sorry.
and homeopathy is no longer like, even Ayurvedic and homeopathy has become a business. It's no longer pure.
Sure.
Uh,
Yeah. And even all the interns of Ayurvedic and homeopathic, everybody has to go through the same training in the OBGYN ward of the public hospitals and the government hospitals, and they do the same things that the mainstream OBGYNs dictate in the birth and labor. Nobody applies the Ayurvedic principles or homeopathic principles in the labor, which their stream actually purely entails. They don't study it, they don't use it in
Mhm.
practice. In practice, what they do to get their degrees, they have to do the internships in public hospitals and practice the mainstream medicine.
Yeah,
Like
yeah.
most of the homeopaths will give you some allopathy in
Allopathy.
some.
Yes.
Yeah. So
Yes.
it's
Strange.
crazy. Yeah, it's not
That's
strange, it's stupid.
it's it's
but it feels like it's something more. I don't know how to say it, but less present. It's more like a higher, some kind of evil trying to
yes. Yes.
fearmonger girls from when they are very young and get them submitted to these doctors, not all, but those doctors that you have to obey, and you
Exactly.
just you know nothing
No,
about
I
yourself
want to be
and
able
your
to,
baby.
I want to be able to have this organized, this group that will, we should be educating. And we, you know, you kind of have to start early. It's now, of course, when women are giving, you know, are fertile, they're in those years, that's one thing. But really, if you can get them early, you know, I'm having to deal with things here in Australia to do with racism. And, you know, when you're dealing with racism, you can't, it's the old people, it's in their head. They're kind of raised with it. It's hard to make them understand, to change, even if they realize they need to change. It's really hard for them to do it. We know we have to start in school. You start with the little kids before even their parents can pollute their brains,
Yes.
even unknowingly.
Yeah. Yeah. My one of my cousins, she's right now preparing for medical. She's giving her exams. I told her that like that there are many people who want to go for who want to be OBGYNs basically. So I told her midwifery is also a career, but then she was like, you know, what about the certifications? What about the degree and everything? She's just in 12th standard. So obviously they are not aware about, but what you said, Kale, exactly my plan was that actually I was going to do one Zoom session, but she told me that do it after August, because right now nobody is in that mind frame because everybody is preparing for the exams, 12th standard and NEET exam. So she told me do it in July or August when we are all you know, like relaxed. So we will take all those kids and we will talk about all these things what we are talking about, because it is very necessary that
Yes.
they, because see, not everybody gets admission for MBBS, because that there is, like in India, you know, there is this open category and backward classes, they get more seats and everything, all this chaos is there. So not everybody gets MBBS, not no, MD for OBGYN, so they can prefer this profession, okay, the midwifery. And we can talk about certifications and how, what certification is, and do you really need a certification for all these things. Because some, like people like me, like I, when I was like when I was in school, I always wanted to be an OBGYN. But why I wanted to be OBGYN? Because I wanted to deliver babies. And I love babies, and that was only the reason. It was not any interventions or anything. But slowly when I did my physiotherapy, then when I started seeing things, I felt okay, all these things are needed, you know. But when I did my childbirth education, I came to know that you don't really need these things, right?
Right.
Baby
But
is
they
going to
should,
come one way or the other.
yeah, exactly. But they should be aware about these things, because as you said, if like 5-7 years they are going to take education in this, their brains are really going to be like, you know, and it's
Contaminated.
very difficult to take
Yes.
out of that.
Well, it's all
No,
about,
no.
it is about the what ifs, right? Because really, you don't need to go to school for normal births. There's nothing happens. You just need to know how to not let the baby slip out of your hands. That's all you need to know. Um, it, so you need, isn't that interesting? 7 years for problems. You do a 7-year intensive course for problems. Far out. And you pay a lot of money for that.
Yeah.
Whereas, what is it, like 99% of births, 95, 97, actually, 97% of births are normal. And we don't study for the normal, but you sure
If
studied
you
a
let
lot.
it,
Huh?
if you let it be normal,
If you let
then
it
it
be normal.
ends out to be normal. But if you intervene and try to control it as a
Which is when it
whoever you
becomes
are,
abnormal.
yes.
But
So if it
That
isn't
that is what
abnormal,
everyone wants.
that's what you learn
That
what
is
to
what
do.
everyone wants, right? That we controlled the birth, we controlled you. That is what everyone wants.
And that isn't,
Yeah.
that's,
We did it for you.
And many people say, and even many of good obstetricians that I've known, they'll say now, okay, now you've graduated. It's going to take you 7 years to get your, for me to clean your brain so you can attend a normal birth. You've got to fix you again. Okay, well, let's try again on Friday.
Yes.
Tapasya, if I could do this at a different time, which would be your afternoon.
Yeah.
I'll look at my time clock and I'll work it out. I know what India is doing.
Maybe you could do it UK time, so that is kind of 5 hours away from here and 7 hours from there, so it's like 5.5 hours away from India, and from here as well, I think 7.5 hours. So maybe we can
just do it on the other.
Not 7 hours.
Actually,
it's
even this timing, the 1:30 timing is fine, right?
It is. Yeah.
Like
you have to check with people in UK. I mean, maybe Vani would like another timing. We need to ask her. She's not around for long.
Oh, it's a bad time for her. And I might try to do another time for the birth workers too, just because I'd love to catch some of my American midwife friends, home birthers. They've all from home birth and backyard stuff, and they have information too that they would probably like to share. That would be helpful. Anyway, it's just a thought.
Yeah, let's see.
But especially the network, I really, really, really want to develop a network. Let's do it. And I haven't, I don't know the issues in South Africa, Heidi, but I have no doubt it's not very different.
It's very similar than India.
And it probably has its own, from what I'm hearing from you, your women are just as desperate. Frankly, from what I hear from England, everybody's desperate all around the world, but some are outright abused.
Yes, and being silenced. The women it's almost like there's no one who wants this kind of thing. Like, it's just so, how can you even be so irresponsible? Do you want to kill yourself and your baby? What, are you stupid? You have to go to the hospital.
No.
It's just so controlled.
So let's try to expand and preach the world and pick everybody up. Give everybody a hand.
Okay.
Thank
Just
you
put
so
it
much,
on the
ladies.
group, the new timings and new date, and let's see how people are.
Yep.
Yeah.
Cool.
Yeah. Okay.
Thank you so much, everybody.
Thank you.
And I'll let you know when the next meeting will be, and definitely next week. See ya.
Bye.
Bye.
Bye. Bye.
Bye.